Good afternoon and welcome to 3 o'clock with SOC. I'm Marisol Diaz, Communications and Digital Manager. Give me a second while I welcome our Spanish-speaking neighbors. Buenas tardes, soy Marisol Díaz, gerente de Comunicaciones Digitales y bienvenidos a 3 en punto con SOC. Si quieren acceso al programa en español, favor de marcar el número que aparece en la pantalla, que es 646-749-3122 y cuando le contestan la llamada, marque la contraseña que es 779-328-221. Si quieren ver episodios pasados, los pueden buscar aquí en nuestro Facebook en la sección de videos y también en YouTube. All right, now I'll go ahead and pass it over to the moderator of the day who will introduce today's topic.
Hi, everyone. My name is Marlene Zaron, and I am the Public Health Coordinator here at the Southside Organizing Center. So let me begin by saying that the interpretation line for Spanish translation is available to you now, and it is in the comments section. You can go and dial in that information. For the Spanish translations, you dial in 646-749-3122, and then you put in the following access code, which is 779-328-221, which they already let you know about that in Spanish a few seconds ago. So just want to say that these videos that we're having in the live forum right now can be accessed through our Facebook page at all times. We do upload the Spanish translation and the English version on our Facebook page. So you can get those, you can watch old episodes, you can watch newer episodes. So that being said, I'd like to introduce Claire Evers, the Deputy Commissioner of Environmental Health. She's here from the Milwaukee Public Health Department to give us some COVID-19 updates. Hi, Claire.
Hi, Marlene.
Hi. All right. It's always great having you on. Claire is working one-on-one with a lot of our public health people, and then our even the commissioner, the new commissioner as well, with on COVID-19 projects and the way that we're moving forwards with the COVID-19 issue and vaccines and the whole shebang. So currently, what are the current updates you have regarding COVID-19 vaccine numbers in Milwaukee and Wisconsin?
Sure. So right now we are vaccinating our group 1A and our group 1B. Our focus in the 1B group right now is still our teachers. And so this week starting last week, we started vaccinating teachers, and we had a large number of vaccines allocated. I believe it was 8,000 this week for our group 1A and our 1B teachers. And so if there are any people in those two groups, the 65 plus teachers, childcare workers, home health aides, all of you are eligible for vaccines. And we do have the supply. I know early on we had some supply issues with our vaccines. We have the supply to meet our demand. So the health department is vaccinating. I know that there's a lot of pharmacies that are also doing vaccinations. And being that we do have the supply we need for those groups, we are opening it up to all 1B. So the current eligible groups, it includes, like I said, the frontline healthcare personnel, long-term care facilities, nursing facilities, police, fire, correctional staff, 65 plus, and now educators and childcare. And then some public-facing workers, some non-frontline healthcare essential personnel, and congregate living. Did just receive word earlier today that our restaurant workers are going to be eligible starting March 15th. And so that opens up another really large group. And then later this month, everyone will be very excited. Age 18 plus with underlying health conditions. So anyone who is highly susceptible for extreme illness with COVID-19, ages 18 and up, will be eligible later this month. And so we are moving very quickly through our phases, getting vaccines out there for all those who want it. Next week, FEMA comes, so we'll have federal aid. I believe it's 70 staff from FEMA will be coming and they will kind of take over our mass vaccination site at the Wisconsin Center. So then our health department staff, we can be focused in the community more. We do have several community partners who are doing vaccinations, but we'll also be able then to get out to more members of our community, into different churches, maybe some barbershops, like into the community, to hit the need where it is. We're using the social vulnerability index to identify specific areas, specific zip codes that really need that support more than others, places that we haven't seen higher vaccination numbers, so we can really get out there.
Wow, that's awesome. That's great work being done. So FEMA is more of a kind of like federal, and they come in and.
Right. So FEMA is, I think it's the Federal Emergency Management. Can't remember what A stands for, but it's federal aid. So they will have staff that come in and they will be running the site. They'll take it over. So then that really alleviates our resources, our limited resources. So we can really get out and hit, smaller vaccination sites and more of them. We're calling them our mobile sites.
Awesome. Great. Yeah. And I did hear about that in one of the council, the Safety and Health Council meeting. I was watching that this morning, and I did see a discussion about the mobile sites and the availability and like which zip codes they'll be targeting first is based on vulnerability, and those individuals will come first. Do you know how often they will be moving those around?
I think the plan will probably be weekly, to have different sites, maybe like 2 days depending on the need, but I imagine it'll be like 2 days at each site and then moving around that way. And then they're hoping, we're trying to get approval from the state to be able to identify that we want like how they're doing it with the Native community, that anyone who is in this community should be able to get a vaccine, because we're seeing such big health disparities. And so I know that is a conversation that is being had to hopefully get that kind of approval.
Which I'm very happy that is how, the procedure is happening, and the process of, figuring out which vulnerable populations should be getting it first, and then we'll move on to other populations. So that's great, because that's a huge issue in public health to begin with.
Right.
So who are currently, oh, you already addressed that. Has there been an increase in vaccines since the past 2 weeks?
Yes. So last week, I believe it was either last week or this week that we actually got 8,000 vaccines. And that is because we started doing our teacher population. And so that was a big increase and that was 8,000 first doses. So when you get your vaccine, you get your first dose, and then you also get a schedule for the second dose. And so when we make our requests, we get not only the first doses, but then they also will send us all the second doses that are due that same week as well. So we did see a large increase when we got to the teacher population. And we did receive our first allotment of Johnson & Johnson vaccines. So the Johnson & Johnson are 1-dose vaccines, and it just received emergency approval, and we did get I don't know the number, but we did get our first small batch yesterday.
Awesome. Yeah, I did see the DHS Q&A that they have. They were saying that it's being allocated as we speak within Wisconsin, but not sure exactly how many as well. So I thought that was really cool, because a couple of days ago they were like, oh, we're not sure if we're having them yet, and then now they were like, emergency time, so they brought them all in.
That's right. So what we're doing with the Johnson & Johnson is we're utilizing that for both our teacher population, because we're really trying to get teachers through the process really quickly so they can get back into the classrooms, or if they're already in the classrooms, they can feel safe in the classrooms. So to be fully vaccinated, it's 2 weeks after your either first dose for Johnson & Johnson or second dose of Moderna or Pfizer. So we're either going to use the Johnson & Johnson for those teachers to get them through the process quicker, or also like our congregate living and our homeless population who are harder to reach, that then we can get them that one shot and we don't have to try to locate them or get them back in for a second shot. So that's what we're kind of prioritizing the use of that one for.
Yeah, that's perfect, especially for that population. So my question is, and I have another question for you. Can individuals who are fully vaccinated can they hang out together?
Yeah, they can. So it's really exciting. The news just came out on Monday. So if two people are vaccinated, they can interact maskless. If you are vaccinated and you have, say, a family member who's not, you can hang out with or interact with one household or one family group unmasked. You don't want to have all of your family over because you got vaccinated and you're safe. Because if your family isn't also vaccinated between the households, they could transmit the virus amongst each other. So that's why the guidance says if you are vaccinated, you can interact with someone else who's vaccinated, no masks, or one household unmasked. And so it's really a great thing. My parents are so excited. They're like, we're going to have the families over again. I said,
Aw.
one at a time, one family at a time. But it's really exciting. It's getting some normalcy back into our lives.
Mm-hmm. Yeah, definitely. All right, awesome. Are there any other updates or anything you'd like to update us on?
I'll just share very quickly because it's still in draft and still being worked on, but we are working on a new order for next week. So looking at our gating criteria, we're in a really great place with both our percent positives and the burden in the city. And so we're looking at releasing a new order next week to be effective next Friday.
Awesome. Yeah, I saw burden was going to start to become a part of the gating criteria now. How do you think that will change things around, or how does that help with the data?
I think burden is a really smart thing to be putting into our gating criteria. It is specific to our community, and it's simply the rates per 100,000. So it's how many people are getting sick. Testing is a really good number, but when people aren't symptomatic and they're not sick, they aren't getting tested. So if you have a testing goal to reach in order to be in a green phase, if people aren't sick and not getting tested, that's gonna hold you back, and it shouldn't necessarily. But we are still using the percent positive in testing as a gating criteria, which makes sense as well. So I think burden is a really good, CDC actually has burden phases on like what you consider low transmission or medium or high or substantial. And so it really gives us something to go off of. And that's new guidance from CDC as of February 12th. And so we're incorporating that into our new orders.
All right, awesome. Well, thank you so much, Claire. We have the Public Health Department's COVID dashboard link and testing sites for you guys in the comments section. And we also will be sharing ways that you can get your COVID-19 vaccine and how to register using the link in the comments as well. Thank you so much, Claire. We will see you on soon. Thank you. Bye. All right. Always great to have Claire and giving us an update on COVID-19 and the COVID-19 vaccine. Lots going on, folks, regarding COVID, and it is estimated that by the end of the year, things should probably be eradicated, but they are saying that, not eradicated, but there should be herd immunity, and until we reach 80% of the Milwaukee population with herd immunity, then we can move forwards with fully opening things back up and possibly getting back to normalcy. And there, many public health individuals in the CDC have stated, such as Dr. Fushi, he has stated that we will most likely continue to wear masks until we are fully aware of the COVID-19 virus and, how it's going to move forwards from here. So now I have a COVID-19 video that was created by one of our youth that's gonna play, and it's to help bring awareness to COVID-19 regarding the population that is 15 to 24-year-olds, since that is the highest age group with COVID cases right now.
I'm getting the COVID-19 vaccine because I want to walk across the stage when I graduate, so I can do things with my family again safely without hesitation, so I can start my freshman year of college in person, so people stop dying, to return to normalcy, to stay healthy, so people can have jobs again, so I can hang out with my friends again, so I can travel, so I don't have to wear a mask anymore. If you fall in the phases eligible for a COVID-19 vaccine, go to city.milwaukee.gov/COVIDvax to register for the COVID-19 vaccine. Someone will be in contact with you once you have filled this out. Thank you.
All right, so we have the healthymke.com site for you guys to register for the COVID-19 vaccine if you fall under the eligible groups. And again, the eligible groups are as follows. So frontline healthcare personnel, residents and staff in skilled nursing and long-term care facilities, police and fire personnel, correctional staff. If your age is 65 and older, now we are vaccinating educators and child care workers, people enrolled in Medicaid with long-term care programs, some public-facing essential workers, non-frontline essential care personnel, staff and residents in congregate living facilities. So that being said, the next eligible groups will be, as of March 29th, people ages 16 and older with certain medical conditions known to be associated with an increased risk of severe illness from COVID-19. So that includes individuals that have cancer, those that have high blood pressure, and one second, I have a little list here of the symptoms or chronic diseases. So yeah, if you have an uncompromised immune system, if you have an immunodeficiency, so those are reasons why that consider you to be under that age group. And then in May, everyone ages 16 and older, it's estimated, will have access to the COVID-19 vaccine fully. So you can also find all of this information and keep up with everything if you go to MKE Health on Instagram. They have a it's the Public Health Department's Instagram page, and they have infographics and all of the updates that you need to see on a daily basis. So that's where I get my information from as well, and I hope you guys go and follow them. So that's at MKE Health. So that being said, we do have some testing sites for you guys that you can go use during this time. So the testing sites are, as you see here, you can go to the Northwest Health Center, and you can also go to the Southside Health Center to get tested, and the American Family Field on First Brewers Way to get tested for COVID-19. Another facility you can get tested at is the Hyatt Pharmacy. They are a pharmacy branch that has recently opened in the last few years, but they are providing COVID-19 testing. And I'll have that link for you guys in the comments as well to register to get COVID-19 tested and see if you can get your COVID vaccine there as well. They're located on South Layton Avenue, and they're in a great location where you can just walk in, get tested, and leave right away. I personally went and got my COVID-19 test through Hyatt Pharmacy, and it was very efficient. They texted me my results within 2 days, and I knew if I was positive and negative. Luckily, it was negative. So yeah, that is my COVID update. That's our community resource flyer for you guys. So every week we'll have a community resource flyer for you all. So that being said, tomorrow, just a reminder that tomorrow we're having Leanna Yang. She is the Director of Outreach and Education from HAWA, which stands for the Hmong American Women's Association. So they'll be coming on to talk about some of their topics and resources. And now I leave you with a survey promo.
Has this live forum been informative and useful to you? What part of the forum could be improved or changed to make it better? Please take a quick survey that's located in the comments section so that we can keep 3 o'clock with SOC going for residents. Thank you for tuning in.
All right. So that was our survey promo. So please fill out our survey. It's in the comments section. We love to see like what topics and what guests you would like us to have on the forum. So that being said, that is the end of our show for today, and I hope you all can join us tomorrow. Have a good rest of your day.